I think of improvement of care always in 4 tiers. I've thought this way for 20 years now. At the base are the interactions with people, helping this person live longer and better, whether it's through a web page or a physical exam and a medicine. That's the encounter. Then there's the microsystem. That's the day-to-day interaction. That's the doctor or nurse or pharmacist or receptionist that's working with people and the processes that allow you to do that safely, effectively, patient-centered way, timely way. It's the microsystem designs. That's IHI's sweet spot. That's where we've been for 40 years, thinking, what does that interaction look like? How do you have no pressure ulcer? How do you have no surgical mishap? How do you have true patient-centeredness? That has to do with the microsystem. Of course, they're now in organizations, and so we deal all the time with C-suites and chiefs of medicine and heads of nursing and organizational context, physical design, architecture, rule bases, budgets. All of that matters, and so that's why we focus on leadership in IHI, leadership of boards and C-suites, and what do you do to help improvement occur? The leaders should serve the microsystem so it can serve the patient and family. But those organizations, macrosystems, they don't exist in a vacuum. They are strongly influenced by, I guess we'll have to call it policy. That's the world around them that's setting the rules, providing the resources and the way you get those resources, the payment system. They provide the training system. They provide the rules for certifying the professionals what they need to know, and they provide the guidance for priorities. You can't ignore that. You can't say, that's above my pay grade or I can't work on that. You must work on that. Because how can the environment be responsive to the organization so they can be responsive to the microsystems without interaction, without a chain of custody, chain of duty, chain of understanding? So I am arguing that we clinicians, we've just got to get involved more than we ever have before in that context setting. It has to do with creative molding of the arena of payment, regulation, training, environment for support of the care we want to give.